Eric Hammer here, registered physiotherapist. Today I'd like to talk to you a little bit about an exercise technique that I like to use for SI joint dysfunction. And so in the SI joint, essentially what it is, it's an area of the body that involves the area between your sacrum, kind of the lower portion of the back, so to speak, and the ilium on either side, which is essentially your pelvis. So basically it's along the side here. And what can happen in the SI joint is, particularly when there's a bit of lack of stability or some weakness in terms of the pelvic floor or some of those deep abdominal muscles, sometimes if there's some weaknesses in the glutes and the hip region, so to speak, what can happen is the SI joint can actually rotate slightly. And so in a lot of cases when individuals are complaining about a specific pain, what's happening is there's different ligaments that attach onto the SI joint and they're being overstretched, or there's some sort of inflammation to some degree there, which is being caused as a result of this rotation. And so part of the treatment in terms of correcting this is, so first of all, we definitely want to work on stability work, so lots of muscular inner core work in terms of stabilizing the pelvis. But the other thing too is trying to actually correct if there's a rotation, so to speak, through here. So for a lot of patients, they'll feel almost as though there's one hip higher than the other, or that things aren't quite even. So a lot of times patients will actually try and put a lift in, because they feel almost as though there's a leg length discrepancy, when in fact there might just be a little rotation in through that area. So I'm going to show you, it's called a posterior rotational exercise, and this is to correct an anterior rotated SI joint. So essentially what I mean by that is patients where there's an anterior rotation, the pelvis, so to speak, on that side will be rotated forward. And in a lot of cases, the patient will feel like one leg, or that leg might feel a bit longer than the other. And so the way that you correct it is by essentially trying to move that pelvis back. And there's a couple different ways to do this. I'm going to show you actually on the back here. And it involves an isometric contraction of some of the muscles that attach onto that SI joint. So I'm going to show you right now. So essentially what you're going to do is you're going to lie on your back, okay? And so I'm going to pretend that my right hip is the one essentially that is anteriorly rotated. So we want to bias it in a posterior direction, so to speak. So the opposite leg is going to stay straight. And basically what you're going to do is you're going to lift up the knee. And you're going to push in the opposite direction. So I'm maintaining, and with my leg, I'm actually pushing downwards. Okay? You don't want to go into any pain with this, but you can hold for a few seconds, then you're going to relax, let it go, and then you're going to bring that leg up a bit further. And again, we don't want to go into any pain with this. You're going to, again, repeat that isometric push downwards, relax, let it go. You're going to pull up again, and then keep going essentially until you can't go any further, and also again staying clear of pain. And then you can just sort of finish off just by holding and maintaining that for a good 10 seconds or so. And then you would relax and let it go. Now, after you've done this exercise, again, I had mentioned that for a lot of patients, they'll feel as though there's this sort of hip or leg length discrepancy. If you're biasing it correctly, it should actually, the hip should feel more or less neutral after normal. So there shouldn't have that feeling of leg length discrepancy. And ideally, it should actually create some relief in that very specific area of pain on the SI joint. Please again make sure you check with a physiotherapist to make sure this is an appropriate exercise for you. And have a great day, and thanks again for watching. Take care.